Health workers call opioid addiction one of the most serious health concerns in our country's history. Dr. Sarah Liskowicz and Robert Parker are two people who have been working on the front lines of drug addiction. So Dr. Liskowicz, what's been the relationship between family doctors and opioid addiction?
So opioid addiction happens when patients become hooked or addicted to opioid medications. Family doctors prescribe opioid medications, and this is often the first place that a patient will get their opioid from. And so certainly this is a place where family doctors are a place where opioid prescriptions and obviously addiction can start with. In the 90s, there was a big trend towards treating pain as the sixth vital. And companies like Purdue really pushed this sort of treating pain as a huge priority, and opioid prescribing started to really escalate at that time. And family doctors obviously were one of the prescribers of opioids where this increased amount of prescribing happened. And so I think over time and through this escalation, family doctors are a big part of the opioid crisis it is today, because it's one of the first places that patients start getting their medications from.
And now we have a crisis of opioid addiction. So Bob, you and Dr. Liskowicz have gotten a $2 million grant, of which you're hoping to help deal with this crisis. What are you hoping for?
Our hope with this grant is to build and create an opioid stewardship program for Saskatchewan. Our start point with the $2 million 36-month grant pilot project is to start in Regina. And by the end of the 36 months, it's our hope that we will move it to a provincial program to help and support all of Saskatchewan. Primarily the Opioid Stewardship Program and stewardship in general, it's not five guys in doing stuff. Stewardship is about building resources, building capacity, helping to support existing pathways that might exist. So we're doing an environmental scan to understand what good things Saskatchewan has already done. What are the barriers and obstacles that exist for family physicians facing those patients? The lack of access that some patients might have to different types of modalities, because sometimes the only option for a physician is to make that prescription. So we want to be able to provide pathways, relationship to pathways that already exist within the organization as well as externally to the Saskatchewan Health Authority to help mitigate some of those cracks that patients might fall through that we've seen in the past.
So Dr. Liskowicz, what are some of the barriers that people face when it comes to getting help for opioid addiction?
So as patients, there's many barriers in terms of just having access in the community to other resources such as, physiotherapy, yoga, some of your whole body focused treatments for pain. Also, there's just education and understanding that chronic pain actually isn't very well treated by opioids. And I think we've come to a lot of that understanding in the last few years, and it's very difficult now that there's been this sort of history of going to the doctor and getting medications for pain that are strong opioids and not understanding that actually this medication isn't great for pain, and in fact it actually causes a lot of side effects and unintended problems like addiction in the future. So I think part of it too, or one of the barriers, is just for physicians to be able to have those really frank conversations with patients and provide for them that understanding. Like if I was providing a patient with a couple options for treating a pain condition, if I said to them, would you like to have this prescription for physiotherapy, which is going to allow you to get to the source of the pain, to understand what is happening and change your biomechanics and do things that are going to actually get to the underlying cause of the pain, or instead I can give you this prescription for opioids and it might cover the pain today, but it also has a very good and as likely a side effect of having constipation or erectile dysfunction or nausea and vomiting. And there's a chance actually in the future, and it's not a small chance, but a chance that if you continue taking this medication down the road, you're going to become tolerant and addicted to it. If physicians presented it like that, it's pretty hard for that patient to choose that second option when there's so many better options that don't require the use of opioids. The problem is though often as a physician, a family physician, you just feel, there's not a lot of, it's not easy to get patients to go do those other things, and so you choose that second option. You don't present the true risks associated with that second option in your office. And so that's a barrier for both patients and physicians, because they feel a little bit trapped in the expectations of the patients and also in what they can offer them from their office.
So Bob, when you listen to Dr. Liskovich, what are you hoping, what are the issues that you're hoping this grant will address?
It's really, I'm hoping that we will find those ways that we can connect to our community physicians. Oftentimes we have our physicians that feel like they're out on an island by themselves. They're not sure of what the connection points might be within the organization or externally to the organization that can help the patients. So it's really my hope that the team that we put together for the Opioid Stewardship Program will really be able to look and focus and engage with our clinicians, our prescribers in community and in the acute care systems throughout Saskatchewan to find the right resource for the patient that they need at that time, and really giving that dialogue between the patient and the physician, the ability to have the conversation, build that care plan for the patient based on what that patient really needs.
And Dr. Liskovich, we're hearing a lot about crystal meth addiction. What's the relationship between opioid addiction and crystal meth?
So both are, are addictions that have, they work in different ways. So crystal meth is a stimulant medication, whereas opioids are strong painkillers and have more depressant properties. Many patients who may start, though, using one medication may eventually end up using crystal meth, which is an illicit drug as well, when they become addicted. Probably the most famous combination historically in Saskatchewan is called the TNR, which is Tolwyn and Ritalin. Those are a combination of a strong painkiller and a stimulant, but methamphetamine is today's Ritalin. And patients are using the methamphetamine, and then they're often using opioids such as Dilaudid to come down off of the methamphetamines more comfortably. Unfortunately as well, in terms of treating patients who are addicted to methamphetamine, it's very challenging in that we don't have a medication like methadone that you use for opioid addiction to replace it and help patients come off of it. So patients who are addicted to both of them or just stimulants are very difficult to treat because we don't have another medication to offer them that will really help, along with addiction counseling and other services to help them get clean.
So Bob, with the $2 million grant, what is your hope going forward?
Going forward, it's really important primarily that we find those pathways for the patients, those treatment options that will support patients with dealing with their pain, dealing with the conditions that they suffer with, and helping build a conversation between the practitioner and the patient, and also providing those decision tools for the physicians. It's really important for our clinician partners to recognize that the Saskatchewan Health Authority is wanting to partner both internally to the organization and externally to the organization to build a support system. It's always my hope with the areas that I supervise that we get the message across to our clinician partners that we are not about policing or shaming, that we are about supporting, about building those collegial conversations, about building collaborative relationships with our health partners, and finding that way that they can have the support, the training, and other future resources that can come along. And again, stewardship is about building capacity, and that's what we want to do with our health partners is see that within that 36-month, not only in Regina but throughout Saskatchewan, we have built capacity to support our patients in community dealing with this crisis issue.
And so Dr. Liskovich, what is your hope that family physicians will get out of this $2 million grant stewardship program?
Well, first of all, I'm very hopeful that they will become up to date on the 2017 chronic non-cancer pain guidelines, and knowing that there are new sort of high-level limits to the amount of opioids they should be prescribing. I hope that they're reminded of situations where actually starting an opioid prescription is not a good idea, and all the risks associated far outweigh any benefit that it can have. I'm hoping that family physicians become comfortable having those conversations with patients and educating patients about when an opioid prescription is a good idea and when it's not, and all the other options and the rest of the menu that we have to offer patients for treating their chronic pain conditions. And I hope family physicians learn to identify those risk factors for certain patients that really are at much higher risk of becoming tolerant and addicted to opioid medications if you write that first prescription, such as a history of mental health problems, which is a lot of patients, a history of sexual abuse, a history of alcoholism in the family. So some of those risk factors, just being able to identify them, being a very young person, and just stopping and going, wait a minute, it's really not worth even offering opioids as one of the things on the menu before I try many other different options, because the risk just is not worth any benefit you might get from it.
Thank you so much for joining us today.